Hi, this is Jessica DaMassa with WTF Health. I'm here at HIMSS Health 2.0 Europe, and joining me right now I have Kaveh Safavi. He is with Accenture and has some research on healthcare consumers, both in the EU and the US, that he's reported on here on the main stage. So talk to me about this research. What were you trying to answer, and what have we learned?
Sure, Jessica. Well, we started with a hypothesis, which is that citizens' expectations of healthcare are being formed by their perceptions and experiences outside of healthcare. And technology is allowing them to personalize their other experiences, so why not healthcare? And we wanted to see, essentially, first of all, where the starting place is and are there differences between countries. One of the first things that people think about is, well, if you pay for healthcare differently, then people must have different attitudes. So we saw some other research that said that if you ask the question, how satisfied are you with the last doctor or hospital visit you had, the answer is, regardless of how you pay for healthcare, only about half the people are satisfied and half are not. That tells us it's probably much more about how healthcare is delivered than how healthcare is paid for. So when we started to look into our data, and we did about 9,000 consumers in 8 countries, half of which were patients, half of which were not patients, we started to see things like somewhere around 3/4 would say that technology is very important or somewhat important to managing their own healthcare, but it does vary by country. For example, in Spain, it's over 80% say very or somewhat, and probably a third say very important. We think that's because in Spain, because of the challenges they've had fiscally, the government has really had a hard time providing services and has begun a narrative that says something like the digital technology is one of the only ways you're going to get healthcare, so people's expectations have gone up. You contrast that with like the United Kingdom, it's one of the lower of the 8 countries we surveyed. And that's very consistent with the narrative that you hear in the UK, which is that improving healthcare is much more about process and structure and organization. And the role of technology has been less common, therefore the population's expectation of the role of technology is a little bit lower.
Okay. What were the other 8 countries that you did, or like total?
Well, so we looked at
Spain and the UK.
we looked at Spain, we looked at Finland, we looked at Norway, we looked at the United States, we looked at Australia, we looked at Singapore.
Ah, very cool. So, okay, I'm sorry to stop you where you are.
No, that's okay.
But I was really curious to know, kind of point of comparison and for our viewers.
All industrialized nations, they're all countries that we do a lot of work in, so we understand the markets. That's the reason why we picked the countries.
Got it.
They tend to be wealthy countries. They tend to spend money on information technology in health and in non-health.
Got it. Okay, so tell me a little bit more about some of the things that surprised you in the findings.
Well, one of the things that we looked at was what people want when they look for their own electronic health record information, because that's generally available or becoming available. At least there's a discussion in every country. Top 3 uses are the same across all countries, the top one being they want to look at their lab results. But the second thing that everyone wants to look at in every country is they actually want to look at the doctor's notes. And the third thing is typically prescriptions, although in the UK for some reason it was x-rays. But we thought it was interesting that the second most common reason is people want to look at the notes.
Yeah, for sure.
And that tells us that it's consistent with other research that tells us that people really want to understand their own clinical condition. In fact, we did some other work that suggested that people don't want to be their own doctor. They don't want to make their own diagnosis. They just want to understand what's going on with their own health conditions. So it's really not just about the numbers. It is really about what the doctor is thinking.
So talk to me a little bit, I guess, about some of the key differences that the survey results showed out, I guess, like between not only maybe the U.S. and the European countries, but also you had mentioned Singapore and Australia.
Yeah.
Like, so how different are people's attitudes towards health and technology?
In Norway, for example, in the top 3 things that people use technology-wise, social media was on that list. But you didn't see that in some other countries.
Okay.
Wearables was in the top 3 in the UK. And smart scales was in the top 3 in Spain. And so every country is a little different, and I think that reflects the evolution of healthcare and of the evolution of the services that they're seeing. And since we're relatively early into this journey, it's not surprising in some ways that these signals are early, and every country is a little bit different in that way.
We have a lot of startup companies that watch us, and I always feel like we should give them good market intel if they want to expand.
Yeah.
So, as somebody sitting in any of those countries that you named, or really anywhere around the world, what do they need to know if they want to bring a tech solution into Australia?
Yeah. So what's really important about that is part of it is understanding the market and from a market acceptance, but the other part of it you can't underestimate, which is the business model environment. Because in some countries, you really have to think about it through a consumer channel or a private payer channel or a public payer channel. Many times the technology, while the sexiest part of the conversation, is the least important to the business, and understanding how these things are going to get adopted tends to be the most important. So if you look at, for example, the UK has largely been driven by a public funder that's made some pretty important investments in certain areas. So for example, there's a lot of really interesting experimentation around digital health for behavioral health in the UK. Okay. A big problem with a single purchaser. While the problem is the same, you don't see the same kind of traction in other geographies just because there's no clear path that makes it so simple. Right. Whereas you see a lot more activity maybe around consumer side wearables, because there's a consumer market that's more vibrant.
Got it. All right, any last takeaways that we need to know from the survey results here?
Well, one of the things that we thought was interesting was whether or not people were afraid of the human plus machine combination. And? So when we asked them, like, are you okay with artificial intelligence assisted surgery, the answer was only about 1/3 would say yes, 2/3 were afraid. But when you told them it would make it better, it went up to 50%. Okay. But when you asked them why, they actually said not because they think that the technology is a better surgeon, but that the human plus the machine together is better than each alone.
Fantastic. So it's really that augmented intelligence that we've been hearing a lot of that. Okay, cool. If somebody wants to access the answers to this survey and to use it for their own purposes, is it available?
On Accenture.com.
Fantastic.
If you look for the Global Consumer Survey, you'll see it.
All right, Global Consumer Health Survey or just Global Consumer Health Survey? Awesome. Thank you so much for joining us. I love hearing about this research. It's so cool to hear kind of what people's sentiments are around this. Great. Thanks so much. This is Jessica DaMassa with WTF Health.